name is Mackenzie Amos, and today I'm doing insulin and checking my patient's glucose level. So I'm going to start by getting all my equipment together, which is my AccuCheck, my strips, and my lancet. And I'm going to compare my order against the physician's order, making sure that I am going to be doing a blood glucose check. So I am. So I'm going to go into the patient's room, introduce myself, and let them know I'm checking their blood glucose and have them tell me their name and date of birth. So I'm going to do some hand hygiene, and I'm going to put on my gloves. These gloves are being difficult for me today. Okay, so I've got my clean gloves on. I'll grab my AccuCheck and the strips, looking to see if they're expired, which they're not. So I'm going to open, get one out, insert into my machine. Okay, so my machine is on and it's ready to go. I'm going to set it aside. And I'm going to get an alcohol swab, and I'm going to ask them where they would like me to stick their finger if they have a preferred finger. So I'm just going to say I'm going to do this index finger. So I'm going to clean it with an alcohol swab. And I'm going to stick the outer part of the finger, not going in the middle, doing the outers. So I've got my lancet. Pull this back. And I'm going to stuck. I have a little piece of blood, so I'm going to wipe that away, and I'm going to squeeze up some more fresh blood to do my reading. So the monitor says their glucose is 252, so that's high. So I'm going to have to give them insulin. Now wipe off the rest of the blood, clean their finger up, dispose of this in the biohazard, and put my equipment away. So now I will get ready to go out the room, and I'm going to get ready to pull their medicine from the MAR. Get these off. Okay, so now I grabbed, the order says that I need 6 units of regular with 16 of NPH. I'm going to get them out and check the expiration, and they're still good, so I'm going to roll them. Kind of mix it up. Okay, I'm going to get an alcohol swab, and I'm going to scrub the top, scrub the hub of both. So I'm pulling up 6 of regular and 16 of NPH, so that will be a total of 22 units. So I'm going to start by pulling up some air into my syringe. I'm going to pull up 16 units of air. And inject into my NPH. Okay. Now I'll pull up 6 units of air. Inject into my regular. And now I can go ahead and pull out my 6 units. Pull up just a little extra so I can get this air bubble out. I can do this with regular since there's nothing mixed yet, but I would not be able to do this with my NPH in. Okay, so now I'm going to insert it into the NPH vial and pull up my 16, which would total to 22 units. Okay, so now I'm going to recap. And I'm going to have my second nurse verify that this is 22 units of insulin, And then after she approves, I will label it with the patient's information and how many units and what all I'm giving. So I'll label that. I'm going to set these to the side. I'm going to grab me some fresh, clean gloves. I'm going to go into my patient's room now, and I'm going to introduce myself again and have them tell me their name and date of birth. Then I'll compare that against the MAR, along with do my final bedside check with my insulin against the MAR. So I'm going to do my hand hygiene. I'm going to apply my new gloves. And I'm going to ask them where they last received their last dose of insulin. So the places I could give it are the outer lateral aspects of their upper arms, their thighs, or their abdomen. So say they got it last in their upper arms, I'm going to give this one in their abdomen. I'm going to clean off the skin, making sure I'm 2 inches below the umbilicus. So the rule is if you can pinch 1 inch of fat, I'll go in at a 45 degree. But for this patient, I'm going to say I can pinch 2 and I'll go at a 90. So I'm going to go 1, 2. Going to insert my insulin. Okay. Discard this in the biohazard bag and apply an alcohol swab. And now I will remove my gloves and I'm going to perform hand hygiene, and I will document what I did. So I will document how much their blood glucose was, how much insulin, so 6 units of regular, 16 of NPH, total to 22 units. I will also document where I gave it, so in the abdomen. And that's it.